This is from her name is I think it's K2Lee89. The video is 3 minutes and 55 seconds. I'm just
Okay.
gonna play a minute and a half. Here it
Yeah.
goes.
I'm going to say this with my whole fucking chest. Something in healthcare needs to change. I'm not sure if any of you guys have been following the news, but here, let me give you a quick recap. In Florida, a man assaulted a nurse, broke every bone in her face. They're saying that she's going to lose her eyes or her vision. In Pennsylvania, a man walked in and open fired a gun, killing officers, nurses, doctors, but don't worry, the report says no patients were harmed. In Kentucky, a woman in the emergency room stomped on a nurse's head, severely injuring her. These are just a few stories that have made national headlines in the last week or so. What people don't understand is that on a daily basis, in an emergency room, dangerous behavior, assault against medical staff takes place. Any other profession, if a patient, if a person assaulted you, police would be involved, charges would be pressed. It doesn't matter if they have a psych history, if they're off medications. If somebody threatens you and physically harms you, there are consequences. I don't know when it has become so acceptable that a nurse, because they're a nurse, or because they work in healthcare, because they choose to care for people that have high acuity, sometimes mental health crisis, have to be subjected to this. It's actually infuriating. People wonder why I left the emergency room. It's not because I don't.
So it goes on. She makes other points, but that's kind of the gist of it. This is something I feel like I've been seeing more and more of. I worked with a nurse at one of my contracts who had her neck broken. She was
Oh my
yanked from
God.
behind and strangled and had three fractures in her neck. I
No.
worked at an emergency department where some male nurse was just fired. He was being pummeled, and in order to get the person off of him, he socked him one to get away, and he was fired for that. Uh, and I know I've personally been told that if you're being attacked, you have to run. Like if you put your hands on them, you're they can't protect you.
Yeah.
What do you think about this? I think she brought up a good point that just because you want to go into the healthcare industry, take care of people, and a lot of these people, most of them, they're not altered mental status, or they're fully capable. They have a sense of morality. They know right and wrong. But if you hit a nurse or whatnot, nothing happens. What do you think about that?
So that's been a problem that we've been facing a lot. We've had multiple meetings and talks with the head of security. So they're trying to do, because for where we work, security is not supposed to lay hands on patients, even if we're getting pummeled to death, I guess. But so that was our biggest issue, especially after what happened in Florida. Our director, we have a new director, ER director, he would walk around and be like, "Do you feel safe?" So he has like these meetings where he comes around and asks you a lot of that a lot of the time. So the head of security in the evenings, they do rounds a lot. They've been trying to make changes right now, but I don't know what it is, but we've seen it, especially after COVID. I don't know what happened after COVID, but people do not care how they speak to you. They do not care if they're in your face. They do not care if they lay hands on you.
Yeah.
We have
I
been
think people are
threatened.
so. I'm sorry to cut you off. I think people are so. There's a lot of aggravation on, I think, COVID. It's been
Yeah.
obviously politicized, and for
Mhm.
good reason, because people did not get, if people feel like they didn't get all the information, or they feel
Yeah.
like certain things occurred that shouldn't have occurred, whatever people's reasons are, uh, that era has been so dismantled. And yeah, people don't seem very happy about in the post-COVID years with regards to medicine.
Yeah.
But yeah, I agree with you with that. People, I think they kind of associate you more with the system, and it's just
Yeah.
like, I'm just a nurse. Like I have nothing to do with the
Exactly.
system that you're not happy with.
Exactly. And that's a good point you made. There's a rooted like anger within that society, within society, that people are saying, yeah, it's mental health for some people. And then there's some things that are untalked about. Like there's no reason for you to come to me and be screaming in my face and being disrespectful or threatening. It's been pretty intense and scary. No one has. We had one of our med techs had his hand broken a few, maybe 2 years ago,
Wow.
with like a really belligerent patient that they were trying to subdue, like just trying to just put him in like the soft restraints, but he just like yanked out of it and broke his arm, his hand. And other people, we just had a supervisor just got punched in the eye. It's just a lot. So, and
But then
some
there's
of
no consequences. You
there's
know,
no
it's like if
consequences.
if I punched you in the street, I'm toast. But if I go to the emergency department, you're taking care of me, and I'm stressed or this or that, and I punch you, it's kind of like, okay, you know, you got hit by. Are you okay? Like,
Yeah.
what? I'm fine. I'm in full control of my faculties. I know right and
Yeah.
wrong. But that's nuts. That's
Mhm.
really kind of nuts. But if I
It's
go to McDonald's and punch somebody, I punch
forget
an
it.
employee there, I'm arrested.
Yeah. And it's supposed to be a federal offense if you assault a nurse, but there's always these, because now that my husband is a police officer, now I understand the fine lines and everything of what open fist versus closed fist and all of these terminologies that you have to use. And then of course you take it to the, when if you do press charges and then it has to go to the assistant DA and then they have to decide if they want to keep those charges or they want to lessen the charges. So
Yeah.
I feel like honestly it should never be that you hit a nurse, you hit somebody in healthcare, you physically hurt somebody, the charges need to stick.
It
So,
gets kind of crazy when they tell you that, like the example of the guy who was getting pummeled,
mhm,
punches his way out of it, then gets fired for that. He
right.
wasn't going after a patient. He wasn't like even like a regular fist fight. Like, come on, buddy. Like, I get that, but you're actively getting punched. And I don't know anything about the guy. I don't remember, but I mean, I'm 6'2", 250 pounds. I've been an all-state wrestler. I mean, all-state football player, all-county wrestler. I was in the military. Like, it's my experience is a lot different than yours,
Yeah.
uh, and a lot of other people. I mean, I've come on shift where the nurse has told me like this person was basically abusing them the entire
Mhm.
night, aggressive, verbally, threatening. And I'll go in there and I'll be like, look, buddy, not on my shift. This is a collaboration. I just won't come in your room. Like I can get away with and 9 times out of 10, it works. We end up being like buddies. That
Yeah.
tough love works, but yeah, there's a lot of females in this business. And for anyone to say, "Oh, that's the business they chose," it's like, yo, it's your mom, it's your wife, it's your daughter, it's your sister.
Yeah.
I don't think so.
No,
And a lot of time,
absolutely not.
yeah. And these aren't most of the time. I'm not talking about altered mental status for whatever
Right.
is going on, or I'm talking about your most of the time regular people.
Yep. Regular people. And yeah, it does infuriate me when I see people say, well, this is what you signed up for. No, we did not sign up to get assaulted. We signed up to help you and to make sure that you're taken care of and whatever you're coming in for, whatever disease process we help to treat that and make you feel better. But we don't expect to be assaulted and verbally abused in the process. Like right now we have something called CPI training, which is like a crisis prevention training. So we have to do that every 2 years in case anything, just trying to get yourself out of certain situations. If you are you know, say attacked from behind, how to get out of that and run
Yeah,
away. So it's mainly of a get out of the situation, run away. It's not a fight or flight. If you have to
yeah.
fight, throw something and then run away. Like, but they don't
But
want
it's
you to
crazy
get
that
to
if
fight
you
it
if
out.
you if you strike somebody, you might get fired. Like
Exactly. The fact
if
that
you're
that's
being actively, and I'm talking about you're getting actively beaten up,
right.
like you're getting punched in the face maybe 3, 4 times, and you're just like, get off of me, and you might get fired for that. That to me is insane.
That to me is very much insane. Like you can't even, you were supposed to just stand there and take this while you can't
Yeah.
defend yourself, maybe save somebody else from getting hurt, right? In the process.
Mhm.
So if he didn't try to like defend himself or maybe like stop and like subdue the person, then somebody else might have gotten punched as well. So why is the person who's trying to help the situation getting punished? So that to
Yeah,
me, yeah. So that's a huge problem. I feel like also in leadership and management in healthcare, they fail to realize and see that we're not just disposable. We get hit, we get pummeled, we get our eyes, that poor nurse in Florida. I think about her all the
I
time,
know. That
right?
that 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 was a very disturbing thing
That was
to
extremely
read.
really disturbing. And just like we all talked about it, we've read the articles, we've seen this, just like, we think about it because we're like, this could be us, this could be our
really could.
coworker, it could be anybody that we know. So
Yeah. And then even myself, you can't feel so, sense of security. Everyone turns their back. Everyone's busy doing something.
yeah,
You don't know someone's motive. They stalk you, they wait for
right.
the right moment, and they clobber you with something. I mean, and who knows what they have on their person?